sir, you are live. You are live.
So you can start.
You can start.
Friends, good morning. Today I am talking about nerves, but many people mix up with that nervous, that man is nervous type. I'm not talking about those nerves. That nervous type is related to mind. Today I'm going to talk about nerves. I should say a nerve. So, structural. I'm going to talk about structural. Where we know, for example, in this is skull, brain. Then from there goes the spinal cord. And throughout spinal cord, the small nerves come out. Actually, they're also like nerves only, but we call them roots. For GP, roots is very important to remember, because it's the roots which more commonly give trouble than the nerves. Spondylosis, cervical spondylosis, for example, roots. Sciatica is roots. So, today we'll talk about these roots. They join together. As they go out, they join together to form nerves. With the result, in a say diabetic patient, for example, in the hand or leg, one nerve is running, and along with that something else could be running. For example, arterial vessels, arteries. The nerves have got a function, electrical function, while the arteries, which is next to it, brings blood supply. Of course, GPs should know this in detail. Nowadays, a lot of malpractice is going on. The moment the diabetic patient gets complaint, trophic ulcers, pre-gangrene, many specialists will say it is the artery which is abnormal. Now, artery can be seen by Doppler, artery can be seen by angiography, like coronary angiography. And then they will say there is some block, and so stent should be put. Very often it is wrong, because the diabetics have got both the diseases. Both can be severe, one can be severe than the other. So, talking about nerves, when the nerve is affected, we call it neuritis, peripheral neuritis. I'm talking about peripheral because neuritis can be central. That we'll discuss later on, in the later part of the lecture. So, neuritis can be single, one nerve. And example, for example, in foreign countries, Saturday night, Palsy is very common. The boy and the girl both drink heavily and have sex and then sleep. The girl sleeps here with the head, and they're sleeping like that. whole night. With the result that the girl's head is on the radial nerve. So in the morning the husband has got radial palsy. Anyhow, fortunately it is mild, and by afternoon it becomes better, by evening still better, by next day it disappears. But it is an example of a neuropathy due to pressure. Another example. You put a plaster, surgeons put plaster after fractures. You put a fracture wrongly on the nerve, they'll have paralysis. So you have to open the plaster, put it again. And the third one is back pocket palsy. Back pocket palsy is in people who put everything in the back pocket, with the result their back pockets are bulging like this. When these people complain of sciatica, the diagnosis is sciatica, which is the wrong diagnosis. In fact, this is the only true sciatica, because the sciatic nerve is running behind the back pocket. If you can tell them to stop using back pocket, the whole nerve pain disappears. Anyway, this is an example of telling you one nerve. When I say one nerve, we from the beginning in the medical colleges, we have been seeing not one nerve, but peripheral neuritis of both the legs. JJ Hospital, I remember, we used to have at a time 660 patients of alcoholic peripheral neuritis. That time was the time of prohibition. It is the prohibition which led to alcoholic peripheral neuritis, because the people started manufacturing alcohol at home, drinking whole day and not eating. You drink whole day and don't eat, you develop alcoholic peripheral neuritis, because you need, when you take alcohol, you need some vitamin B complex. These poor people, they don't know about that. So they would come to the wards, we'll give them injections of B complex. Within a week they will recover. So often injections of B complex out of stock. Government hospital, really, out of stock. So only tablets are available. We used to give them tablets of B complex. Sometimes tablets out of stock. Even then we will not discharge them. We used to keep the patient in the ward. And after a week or so, there was at least 50% improvement, and patient would like to go home. And they would go and say that JJ Hospital treatment is beautiful. We gave nothing. We gave nothing. But the diet contained enough B complex to help him to recover. That was our position in those days. The relationship of alcohol and neuropathy. Today it is the reverse. There is no alcoholic neuropathy. There is no prohibition. There is free drinking. And everybody is drinking 2 pegs, 3 pegs, 4 pegs. And all of them go home and eat food. They eat food. In fact, many of them are taking B complex tablets. With the result that alcoholic peripheral neuritis has disappeared. There was a time in the medical college, 50 years back, I used to tell them, show me one patient of alcoholic neuritis, 100 rupees I'll give. So rare it became. So then, the point is, what are the other causes of neuritis, which was as common as alcoholic? Now, diabetes has replaced it. Today, diabetes is the leading cause of peripheral neuritis. So much so that I tell the doctors to keep this tuning fork. And if you can see that the patient cannot hear vibrations, 90% chance he's got diabetes. 90% chance that he's got diabetes. Then we come to another cause of neuritis, and that is called carpal tunnel syndrome. Here also there is an entrapment. Here also there is entrapment. But entrapment is different type, in the sense that at the wrist, you see, all these vessels, they come from the top. Arteries, veins, nerves, and they all have to pass here at the wrist through a tunnel called as carpal tunnel, which is very tight, quite tight. So they pass underneath. So it happens that some patient having these nerves there, they start developing symptoms of neuritis. And I'll show you just in my next video. Most important, last, this, oh my God, what a hathiyar. Last 27 years, I must have brought at least 15 times patients and shown the magic which this has done. Magic which it has done. Last year, I brought that Indian girl from America. Same thing, she had symptoms. And private practice is very easy, I'm telling you, provided you forget your theory. If you don't forget your theory, very difficult. Because patient says, हमको इधर कुछ झुंझुन होता है, इधर झुंझुन होता है. Now you start reading your theory, 100 causes. There are no 100 causes in private practice, there are only 2 causes. If any symptom here, say from here to here, let us say, more. Only 3 causes, only 3. Either cervical spondylosis, because cervical roots run like this, C5, C6, C7, T1. From there you can make out. And then you'll stretch like that and you'll get pain in the same area. Oh, this is spondylosis pain. Not by looking at an X-ray. Number 2, frozen shoulder. Very common. The commonest disease in private practice. You don't examine the patient, that's the trouble. You see every patient, you do this. See, abduction, and then this, complete. So, once you do that, if you can't do, he does that. It's a frozen shoulder. That is the time to start treating him. Before he becomes like that, he can't do more than this. Before he does the pain, which will come at night, it will cause insomnia, horrible. In the end, pain disappears after 1 year, but he can't do this. He can't put the hand in the pocket. So if you tell him ऐसा नहीं करेगा तो बैक पॉकेट में, बैक पॉकेट तो है ही नहीं हमारा, हम तो पैजामा पहनते हैं. नो यू कॉट, पैजामा पहनते लेकिन संडास करने के बाद ये तो साफ करते हैं ना, ऐसा साफ, वो नहीं होएगा, वो नहीं होएगा, हाँ वो नहीं होएगा तो क्या, ट्रीटमेंट करो. क्या ट्रीटमेंट? फिजियोथेरेपी इज अ ट्रीटमेंट. फाइनली थर्ड कॉज, एनी सिम्टम्स हियर, carpal tunnel syndrome. Carpal tunnel syndrome, I'm telling you, extremely common in private practice. That the median nerve which starts from here gets compressed in the carpal tunnel. So the doctor will give injections and cut here and whatnot, nonsense. You do simple this. You tell them to put this like this. This is the elbow joint. 1 inch below that. Put this like that, and this you should keep in your clinic. Give it to the patient, because this 18 inches. In the market you get only 12 inches. Not 18, very difficult. So it should be there. Why? Because you want like this. And tell him to put a ordinary bandage. So that this wrist should remain like this in the sleep. See, he's sleeping, he's moving his hand at night. But this is not moving, this is not moving. If you put it like that, he can't get sleep because see, this joint is gone. We don't want this joint, like this. And once he sleeps like this, for 7 hours that nerve gets rest. Because the wrist, otherwise this is moving all the time. Moment gets rest, the edema goes away. Edema goes away in 2-3 days the symptoms start improving. 2-3 days. 2-3 weeks, so he is gone, normal. Is carpal tunnel syndrome, and when the doctors miss it, these people when they become old, 18, 90 years old, see what they develop. They develop atrophy of the muscles. All these muscles disappear, and you can do nothing. You can do nothing. So, carpal tunnel syndrome is extremely common. Yes, you can do electrical studies and diagnose. I'm not saying you can't diagnose by electrical studies. But the frequency of it, and I want to tell you about this patient I had from Saudi Arabia. Saudi Arabia patient usually don't come to Bombay for treatment. It's only a Gulf patient. But anyhow, this fellow was a very rich merchant, and Abdullah was his name. Very small, short, unusual type of personality. But anyhow, he went to America first. They call it America, USA. Very few Arab patients go to America. They are afraid. Somehow they don't know the language, English, etc., etc. Then he went to Britannia. Britannia is, they call it all this, Britain as Britannia. Then he went to Almania. Almania is for Germany. Many Arab patients have got faith in Germany. Then he went to Russia. They got Russia means Russia. In Russia he met somebody who told him that you are going for your complaints everywhere. You go and see O.P. Kapoor in Bombay and you will be alright. He was very impressed. He took a flight, came to Bombay, went to get the Taj Mahal hotel, booked the room. He said, for how long? He said, indefinitely. He was ready to stay as long as required, a few months or more. When he came, he was a severe diabetic. Severe diabetic means peripheral neuritis. Severe peripheral neuritis. So he had severe peripheral neuritis of the leg. His complaint was not that. He was taking treatment, tolerating the symptoms. His treatment, his problem was he could not sleep at night because of paresthesia in the hand. He could not sleep at night, and the poor fellow was wanting to have at least one night's sleep. So he said, somebody has given you your name. I told him, don't worry, I'll treat you. So I gave him this. I said, you tie this, Taj Mahal Hotel, let them all witness, and let me know after few days how you're feeling. No drugs, no injection, nothing. It was a Tuesday. He came back on a Friday. Saturday we are closed. Sunday is my lecture day in Birla Hall, where 1,500 people used to attend. And these Arabs are very scared to go to on the stage. Even if you give them lakhs of rupees, they will not go on the stage. Never. When this fellow came, Abdullah came. So I asked him, so Abdullah, what happened? Oh, he said, doctor. He says, the very first day I had 20% sleep. Second day, 40%. Third day, 60%. I'm having 60, 70% sleep. I booked my tickets for on Sunday, Saudi. Now what about your money account? You're not charged anything. So I said, I will not charge you anything, provided you come for my lecture on Sunday morning. He agreed. And when the crowd saw him, that this fellow was in 3-4 days, and he was so happy and jovial. The crowd was clapping. This fellow was kissing me here on the stage. So I said, okay, you can go to your native place. Now, I'm sure they must have done electrical studies. I'm sure. So maybe they found both peripheral neuritis and carpal tunnel. So he was not treated for that. So just to tell you how common is this carpal tunnel syndrome. So this, when we talk about nerves, a single nerve, I gave you example. Entrapment like carpal tunnel syndrome. Then double nerves, both the limbs. This is the commonest. This is commonest. Very, 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 very common. And picked up by this, which I showed you tuning ago. And then of course there is polyneuritis. Poly means all the nerves in the body. So all the nerves in the body can be affected and you can die. I don't think most of you will see more than one case in your lifetime. This. But if you do see, please remember that moment you diagnose this, put them in the ICU, otherwise they will die. Because when the respiratory muscles get paralyzed, they can't breathe. So it's not worth spending time on that. We are going to spend time on this. Peripheral neuritis, which is very common in all diabetic patients. So, formerly we used to say alcohol and diabetes, alcohol is gone. The only diabetes is left, finish. So they have symptoms of anesthesia, hyposthesia, either less sensation or more sensation, lightning, burning, pain, severe pain. They can't sleep. All sort of paresthesia are the symptoms of peripheral neuritis of diabetes, a complication of diabetes. So, in affording patients who are too much complaint, I usually ask for electrical studies. Electrical studies because if they report axonopathy, if they report, that's very bad. That patient more not likely to recover. If this is the nerve, this central, this is axon. Axon, we call it axon. AXON. If this axon goes away, recovery becomes very difficult, very rare. Now, diabetic neuropathy can be of how many types? All types. You can imagine any type. It can be monomultiplex, polyneuritis, mixed sensory motor, purely sensory, autonomic Autonomic system is a very delicate system. It's affected in very severe diabetic patient when it's affected. Life is difficult to live. Life is, in fact, many of them die earlier than the other patient. They develop impotence and postural hypertension. This is what will give you the first indication that patient symptoms are due to autonomic nervous system. The patient sleeps, you record the blood pressure, he stands up and there is a fall of nearly 20 millimeter. That is postural hypertension. The problem with urine and stool, bladder problem they develop, and the stool problem. And at night they get diarrhea. There are very few medical conditions where you get diarrhea at night, remember that. Like the commonest condition of irritable bowel syndrome, rampant in the population. You never get night diarrhea. And then this tachycardia helps you. All the time tachycardia, resting, tachycardia, he is sleeping, tachycardia. There is no condition. Thyrotoxicosis can be ruled out. That's all. This is the condition where there is diabetic, autonomic. There are a lot of drugs which have been described to give relief in diabetic neuropathy. Lot of drugs. I personally, this is my personal, have got faith in amitriptyline. Why? Because I have used amitriptyline for 50 years, 60 years for depression. It's a safe drug. I want to use a safe drug which can be given for a long time. So 25 to 75 milligram. So I call this therapeutic test. You give 25 milligram, wait for 3 days. It is not better, make it 50. It is not better, make it 75. It is better. Continue 75. But not better, stop. Then some other drug. Some other drug like, for example, gabapentin, pregabalin. They are very costly drugs. Please remember, all these middle class patients, you are making them spend money at the cost of the education of their children. So gabapentin can be given in a very large dose. Pregabalin can be given 75 or 150 milligram. Coming to drugs like carbamazepine, Tegretol in the market. This drug we have used for epilepsy for a number of years. So moment you have used a drug for something else and it's safe, there some side effects are there, but otherwise safe. Better to go for that. You can apply 5% lidocaine patches on areas which are very painful. And now I want to tell you that in my practice, if at all investigating a patient, the costliest investigation in a patient, costliest. People talk about PET scan, this scan, that scan. Costliest investigation is investigation of peripheral neuropathy. I usually give up. I don't know. I send it to a specialist. Let him have the headache. So, you can see the number of investigations. All SMAs, well, the ANA, TSH, tumor markers, porphyrins, metal tests. They are very costly. Lead, etc. Drug toxicity, drug levels. They are very costly tests. HIV. To add to the whole thing, few years back when we came to know about this new disease called as vasculitis, we were very impressed. that if you can diagnose vasculitis with steroids, the response is beautiful, beautiful. So I had this friend of mine in Pune who severe diabetic neuritis, he could not walk. He could not walk for months together, lost his practice. And one day I told him, did you get this biopsy done of the sural nerve? Sural nerve is a small nerve, so biopsy can be done. He did it. Diagnosis was vasculitis. He was given steroids in large dose. He recovered completely and practiced for 10 years more. So, once you get a patient who is not a diabetic, all I want to tell you is, please refer him to a specialist for investigation. That what is the cause? Has he got this? Has he got this as a cause? Has he got this as a cause? Then we come to polyneuritis. Multiple nerves all over the body. In the past, we call it acute Guillain-Barre syndrome. Guillain-Barre syndrome. I compared it to diseases abroad. Attacks of MS. MS is multiple sclerosis. Multiple sclerosis is a disease very rare in India, very common abroad. Suddenly you become paralyzed, finished. That is multiple sclerosis. So I was comparing it that if we have got a disease in India, if at all, that is this Guillain-Barre syndrome, which has got multiple names. See, in the past, this was a terror, no? This disease. So people call it acute idiopathic polyneuritis, acute polyneuritis, acute allergic polyneuritis, Guillain-Barre syndrome, Landry's paralysis, acute polyneuritis. All these are same disease. They are all paralytic polyneuritis. Neuritis all over the body, where there is paralysis is a complaint. And therefore, when the respiratory muscles get affected, they die. They should be on a ventilator. Now, of course, they have found out some cause like campylojejunum. It's like finding the cause of stomach H. pylori. What difference it makes? Doesn't. But the disease is there, and the treatment is what I told you. No, you have to be only once in a lifetime if you hear this, that somebody getting paralyzed from the top, bottom to the top slowly. In 1 or 2 days he can't walk. That is acute paralytic. I think the commonest word people are using is Guillain-Barre syndrome, because they are the people who first described the disease. Now, all I want to advise you is, if you ever get a patient and the relations come to you, the doctor says, I can either give injection, immunoglobulin, or plasmapheresis, or steroids in large doses. Large doses. Always tell the patient to go for immunoglobulin. It is costly, but in 5 days, recovery will be excellent. Excellent. So things like sciatica. Now these are not nerves. You do the dorsiflexion and you find big toe is not working. So operation, otherwise 90% recover. So those are not nerves, those are nerve roots, which I told you early in the lecture. Roots. Similarly, this is another nerve root. Patient has severe pain in this area, like this, severe pain. Doesn't allow you to touch. Then there is a rash. That is herpes zoster. It's not a nerve. It's a nerve root. Then we come to cranial nerves. In the cranial nerves, peripheral, the nerves of in the brain, they can also get affected. So you should know about them. Now, I'm going to discuss these third, fourth, sixth, after fifth nerve. Fifth nerve is trigeminal neuralgia. Come on, let's see. Trigeminal neuralgia. No, trigeminal neuralgia, trigeminal is the name of the nerve, fifth nerve. Neuralgia. It's a very, quite a common condition. Miss 9 out of 10 doctors will miss it. Now let us see the video. And the day I was taking this lecture, Salman Khan came for my lecture. So I told Salman Khan, you teach them about trigeminal neuralgia, because he suffered like hell. 7 years no diagnosis was made. He suffered like hell.
थैंक यू, शुक्रिया सर, कमाल करते हो सर, थैंक यू। अब मुझे पता चला है कि आप लोग सुबह सुबह 7 बजे क्यों आते हैं यहाँ पर। सर आपके सारे लेक्चर्स ऐसे ही होते हैं? लवली। इस बात का ताज्जुब नहीं है कि 330 हो गए, इस बात का ताज्जुब है कि कभी लेट नहीं हुए, और वो भी सुबह 7 बजे, और ज़्यादा पकाऊंगा भी नहीं। अब जैसे कि हम लोग चले गए थे मेरे इलाज के लिए, अब जब मेरे इलाज के बारे में, मेरी बीमारी के बारे में सुनते हैं तो लोग बोलते हैं अल्लाह बेचारा मर जाएगा क्या। अरे दर्द होता है, शदीद दर्द होता है, और इस दर्द का मुझे एहसास उस वक्त हुआ था जब पार्टनर की शूटिंग कर रहा था मैं दुबई के अंदर, तो मुझे साइनस था उस वक्त। तो जब लारा दत्ता ने मुझे हाथ लगा तो मुझे करंट आया, मैंने बोला माँ, तो मैं लारा व्हाट इज दिस यार, दिस व्हाट हैपेंड, आई सेड व्हाट अ शॉक। उसके बाद नेक्स्ट डे मेरे मेकअप आर्टिस्ट ने मुझे हाथ लगाया पफ से, मेरे को वापस जो करना, मैंने बोला ये लारा का इफेक्ट तो डेफिनेटली नहीं था। फिर घबराहट हुई कि ऐसे करंट, मेरा मेकअप मैन जो कि लड़का है वो भी करंट मार रहा है मुझे। देन आई वेंट इन चेक्ड इट अप कि ये है क्या। तो उस वक्त मुझे बताया गया कि ये साइनस है। ऐसे इतना भयंकर साइनस, अब चलता गया चलता गया चलता गया, पानी से प्रॉब्लम हो, एसी से प्रॉब्लम हो, हर चीज से प्रॉब्लम हो, वहां से ये यहां पर हुआ करता था मुझे, तो यहां से वो दर्द यहां पर आया। देन आई रियलाइज कि ये डेफिनेटली साइनस ही होगा, और क्या हो सकता है। अब ये पूरा सिलसिला करीबन 1.5-2 साल निकल गया। उसके बाद यहां से लेके यहां तक आया। अब जब यहां पर आया तो फटी गई भाई। इट वाज, एक ऑमलेट खाने के लिए 1.5 घंटा सुना है आपने। अच्छा ये 7 साल, ये 4 साल हो गए, 4 साल और बाकी के 3 साल यहां पर। तो उस वक्त जब मैं एकदम फिट और रिप्ड लग रहा था ना, वो इसलिए लग रहा था क्योंकि मेरा डाइट एकदम करेक्ट था। मतलब लंच ब्रेक के ऊपर तो ऐसा लगता था कि काय को लंच ब्रेक हुआ यार, अब खाना भी खाना पड़ेगा। तो वेट लॉस करने के लिए 3 चीज करना चाहिए या नहीं करना चाहिए। वो एक ब्रेकफास्ट नहीं खाना चाहिए, लंच नहीं खाना चाहिए और डिनर नहीं खाना चाहिए। और ट्राइजेमिनल न्यूराल्जिया के अंदर ये पॉसिबल है क्योंकि इतना शरीर दर्द होता है, बात नहीं कर सकता। अब मेरी कुछ पिक्चरें देख लो, वीर वगैरह के अंदर ऐसा आवाज की, और जहां थोड़ा मुंह खोल तो फिर उसके बाद मेरे अंकल डेंटिस्ट हैं, डॉक्टर दिलीप चरक। तो मैं, किसी ने मुझे बोला देख यार ये शायद ये कोई डेंटल प्रॉब्लम है। तो मैं चला गया डेंटिस्ट के पास। उन्होंने कहा कि ये कोई डेंटल प्रॉब्लम नहीं है, सब दांत एकदम बिल्कुल बराबर है, कुछ भी नहीं है, कैविटीज भी नहीं है। फिर चेकअप के लिए गए। तो जब चेकअप के लिए गए, ये इसके लिए इसमें इस चक्कर के 7 साल गुजर गए। जब चेकअप के लिए गए तो अब मैं आपको बता रहा हूं कि ये ट्राइजेमिनल न्यूराल्जिया जो मेरी बीमारी है, ये सुपर्ब किस लिए है कि जो फर्स्ट टाइम चेकअप के लिए गए थे तो दे सस्पेक्टेड माउथ कैंसर। अरे मैंने बोला ये तो बहुत ही खतरनाक है। फिर गॉड, माउथ कैंसर, ये तो फिनिश फॉर एन एक्टर। तो इट्स लाइक मतलब कि हाँ सलमान करके सब लोग निकल जाएंगे। एनीवे, तो ये हुआ, थैंक गॉड कि 3 डेज के अंदर डॉक्टर शर्मा रूल्ड इट आउट कि नहीं, कैंसर आंसर कुछ नहीं है। थैंक गॉड, अब जो भी है बराबर है। सो केम दिस, बातों के अंदर डॉक्टर्स आर स्टैंडिंग। आई सेड, डॉक, you'll have a drink? This small one, yeah, I got surgery tomorrow. I said, sure. I'll have one. Yeah. He said, yeah, Salman, when did you feel better? I said, doc, I can have dinner daba ke. After 3-4, na, I can properly eat. Then I can talk. I can eat properly. He says, yaar, ye to tera nerve problem hai, yaar. He said, you must be having trigeminal neuralgia. तो उसके बाद हम लोग गए इलाज कराने। अब इलाज कराने गए तो एक ऐसा लगा कि भैया ये तो भी टाइम है इसमें जाने के लिए। कफन में लेके चले गए मेरे को, वो एमआरआई मशीन में। अरे मैंने बोला ये तो ग्रेव में जा रहा हूं भाई, इसको तो जब तक अंदर गया हूं तब तक ठीक था, यू नो। वो जब स्टार्ट हो, मैंने बोला निकालो रे निकालो, मेरे को यहाँ से निकालो। कि हम लोग सोते ऐसे है ना, ऐसे सोते हैं। अब इसके अंदर क्या होता है कि यूं सीधा जाओ, और जिसको साइनस का प्रॉब्लम है वो जैसे आदमी लेटता है, ही कांट ब्रीथ। अब दिस इज द मशीन, उसके ऊपर से एक हेलमेट आ जाता है, बिकॉज ये बैक वैक का तो एमआरआई नहीं है, तो हेलमेट आता है तो सुन, और स्ट्रैप कर देते हैं अंदर। मैं बोला यार ये कोई अगर डॉक्टर नहीं निकले, कोई और निकला तो ये तो छोड़ के चले जाएंगे मेरे को यार, कि लंच ब्रेक हो गया, चलो लंच खा के आते हैं उसको अंदर। तो ये सब मेरे दिमाग के अंदर चल रहा है। अब अंदर चले गया हूं मैं, बोला यार यहाँ पे विल पावर दिखाई दो, क्लॉस्ट्रोफोबिक हो रहा लेकिन चलेगा, कंट्रोल नहीं हुआ। बाहर निकालो, बाहर निकालो, बाहर निकालो, बाहर निकालो, बाहर निकालो, बाहर निकला, बाहर निकला, बाहर आया तो एक नर्स बोलती, हैला हे सलमान खान आए क्या? इसके अंदर तो जाना ही पड़ेगा बहुत, यहाँ पे तो एनीवे अंदर चला गया। एक बार हो गया, वो हो गया एमआरआई मशीन का पूरा स्कैन वैन वगैरह, रिजल्ट भेजे हम लोग ने वहां पर, एलए भेजे, पिट्सबर्ग भेजे, तो उनको कुछ दिखाई नहीं दिया, क्योंकि हमारे मशीन उस वक्त हमारी जनरेशन के, तो हमारे इक्विपमेंट स्लाइटली जो है वो, तो उसी दौरान एक आई थिंक कहीं वेयर द प्लेस, पिरामल, हाँ, वहां पर एक नया ताजा फ्रेश बड़ा मशीन आया। अब एक बार कर चुका हूं, अब दूसरी बार भी जाना पड़ रहा है मेरे को। मैंने बोला विल पावर कहीं और दिखा दें भैया, वो कुछ है क्या डाल के सो जाऊं मैं? तो देन दे गिव मी sedation, I slept and then I used to wake up, so खत्म हो गया, मुझे मजा भी आने लग गया था। उन्होंने डॉक्टर्स ने उन्होंने इवेंचुअली लिखवा लिया कि भैया दिस इज ऑन योर ओन रिस्क, कि इतना दे दिया है, इसमें हॉर्स मर जाएगा। लेकिन उनको क्या पता है कि हम काफी आदी है इन सब चीजों से। एनीवे, तो अंदर जाके बाहर आए तो फिर उस वक्त हमसे बोला गया था कि तुम यहाँ पे इंडिया में क्यों नहीं कराते। तो इंडिया में इसलिए नहीं कराते क्योंकि डॉक्टर्स तो बहुत अच्छे हैं सर, एवरीबडी इज सुपर्ब, ज्यादा करके बाहर हैं। जो यहाँ पर हैं उन बेचारों के पास वो इक्विपमेंट नहीं है जैसे हमारे पास। जैसे ये जो ऑपरेशन हुआ था वो मेरे फैमिली वालों ने बोला था मुझे कि 45 मिनट से 1 घंटे का ऑपरेशन है और कुछ काटम पीटी भी नहीं है। एक लाइट आएगी, गामा नाइफ है, उसे जैप कर देंगे। सी यू लेटर, वी आर इन द कॉफी शॉप। सर 8.5 घंटे, 8.5 घंटे। अरे बोला ये क्या है? अच्छा 8.5 घंटे के लिए एक इट्स लाइक लिटरली मैंने देखा है कि कुछ एक गैजेट यहां पर आया है सर के ऊपर, नोकीला गैजेट, और उसको यूं होता है ना जैसे गटर का एक वाल्व बंद करते हैं, उस तरीके से वो नोकीली पॉइंटेड 4 ऐसे चारों तरफ से वो ऐसा बंद कर रहा है और गढ़ते जा रहा है, गढ़ते जा रहा है, गढ़ते जा रहा है। बोला क्या अंदर घुसवा देगा क्या? ये सर्जरी का प्रोसीजर ये है? आई कुड नॉट फील एनीथिंग क्योंकि उन्होंने सेडेट वो पेन किलर दे दिया था, इंजेक्शन दे दिया था मेरे को, बट वो जो निशान थे वो काफी दिनों तक थे। अब ऑब्वियसली वो करना पड़ता है ताकि सर हिले नहीं, बिल्कुल ना हिले। सर क्या आंख भी नहीं हिल रही थी मेरी, और देख रहा हूं फैमिली को वहां पर अरबाज। अब जा रहा हूं बेहोशी के आलम में, क्या देखता हूं कि अरबाज वहां पर खड़ा है और अरबाज यूं कर रहा है, फिट आदमी। सोहेल टाइम देख रहा है कि कब निकलेंगे यहां से, बाहर जाएंगे। हाँ अरबाज, और मैं देख रहा हूं मेरी आंख यूं बंद हो रही है। सडनली ऐसी डॉक्टर टेकिंग अरबाज आउट। अब मुझे मालूम था कि जब मैं अंदर जा रहा हूं यहां पर तो अरबाज, सर ये लिवर किस तरफ होता है? यू नो आई हैव बीन वेरी केयरफुल डॉक दैट, बट यू नो वंस इन अ व्हाइल आई हैव अ ड्रिंक और टू, तो इट्स ओके ना। बट आई बीन फीलिंग अ पेन हियर, पेन। तो अरबाज ने जितने चेकअप्स मैंने अपनी लाइफ में नहीं कराए होंगे अरबाज ने करवा लिए। मेरे 8.5 घंटे खत्म हो गए, मैं बाहर निकल आया, अरबाज का अभी तक चल रहा था। एक और रीजन है कि जब कहा गया था कि ये ऑपरेशन आपने बाहर क्यों कराया, एक तो बहुत ही सिंपल सा रीजन है, बिकॉज जैसे कि अगर मुझ जैसा कोई हॉस्पिटल में जाए तो वहां पर बहुत सारे डिस्ट्रैक्शंस क्रिएट हो जाते हैं। जैसे कि जब मैं अभी आया तो डॉक्टर्स ही, ऐसी जगह जाओ जहां पे कोई आपको जानता नहीं हो तो दूसरों के लिए इनकन्वीनियंस नहीं हो। ऐसी जगह जाओ जहां पे इक्विपमेंट सुपर्ब हो। एक डॉक्टर जिसने एक सर्जरी नहीं हजारों सर्जरी की हो। सो हजारों सर्जरी करने के लिए योर इक्विपमेंट हैज गॉट टू बी दैट गुड। और मुझसे कहते हैं कि यार यू खुला खुला बोल देते हो अपनी बीमारी के बारे में। ऐसे बीमारी क्या है यार, ये सिंपल सी चीज थी, वी हैव टेकन केयर ऑफ दैट एंड दैट्स फाइन। अच्छे से डॉक्टर्स भी मस्ती कर लेते हैं। अब जब स्कैन के लिए चला गया अंदर तो देखिए सलमान खान के सर के अंदर क्या क्या है, ये आदमी सोचता कैसा है। तो उन्हें यहां से डाला, सीधा दे वेंट थ्रू। अब ट्राइजेमिनल न्यूराल्जिया तो देख लिया उन्हें, तो डॉक्टर बोल हाई ला, आई एम सरप्राइज हाउ दिस गाय लिविंग। 7 साल से ही इज फेसिंग दिस पेन, क्योंकि अपेरेंटली इट्स अ मैक्सिमम ऑफ सुसाइड्स आर कमिटेड ऑन दिस ट्राइजेमिनल न्यूराल्जिया। ये सब मुझे बाद में पता चला है। अगर ये थॉट मेरे दिमाग में पहले डाल दिए होते तो इट वुड बी डिफिकल्ट। तो घुस रहे अंदर, ट्रैवल कर रहे दिमाग के अंदर, तो उनको एक एनेरिज्म दिख जाता है और एवी मैलफॉर्मेशन। एक ही सर में ये तीनों चीज होनी थी। जो भी है इट इज बेटर देन द फर्स्ट वन। अब एक हो गई है, यू लकी यार, यू फाउंड आउट, अरे उसका इलाज भी तो होना चाहिए यार। अब लेके चल रहा हूं कि यू कांट बेंड, कॉन्स्टिपेशन नहीं हो सकता आपको, ब्लड प्रेशर राइज ऊपर नीचे नहीं हो सकता आपको, झुकना नहीं, ऐसी कोई एक्सरसाइज नहीं कर देना, ये नहीं कर देना, वो नहीं करना, अरे यार इलाज निकालो इसका जल्दी से प्लीज कोई. But anyway, it's only 3.5 mm. People have lived their lives with this. I am living my life with this. There's nothing to worry about. It's all cool. It's all chilled out. And especially ये vein nerve क्या है? Nerve. इस डिपार्टमेंट के अंदर बहुत सारी रिसर्चेस हो रही हैं और एवरी 3-4-5 महीने के अंदर कुछ ना कुछ नया निकल रहा है. तो ये जब चीजें नया निकले, कॉइलिंग हो सकता है, बट ऐसे जगह पर है कि जहां पर कॉइल नहीं कर सकते हैं अभी. एक ऐसा टाइम आ जाएगा जब सब ठीक हो जाएगा. पीपल लिव देयर लाइव्स. आई एम डूइंग एवरीथिंग. आई एम वर्किंग आउट. आई एम वर्किंग. आई एम पार्टिंग. आई एम हैविंग अ ब्लास्ट. इट्स ऑल गुड. सो देयर इज नथिंग. जब अच्छा ये प्रेस वाले भी कभी कभी सर आपकी तबीयत कैसी है? अबे यार ठीक है, ठीक है. देयर इज नथिंग टू वरी अबाउट. Living our lives and we're living it beautifully. And if anybody has got the symptoms, like I've just explained कि एक current आता है, एक short circuit जैसी feeling आती है, then that would be trigeminal neuralgia.
No, at the moment, if you heard his complaints, what did you notice? Number one very bad thing what happened was 7 years duration. 7 years duration. Is somebody to suffer for 7 years from such a complaint is a shame. I mean, that doctors couldn't diagnose. So I mean, my students diagnose it in 5 minutes because it's a common thing. It's not an uncommon thing. Second thing which you notice, he went on saying sinus. This sinusitis has ruined the diagnosis of intracranial headache. Remember that, please. Sinusitis is most often wrong diagnosis. Yes, sinusitis is present in people who are getting cold, allergy, nasal discharge. Then you get from the nose watery discharge, sticky watery discharge, and that is sinusitis, and that responds to anti-allergy. But otherwise, sinusitis should not be diagnosed. And now, of course, we have got endoscopes nowadays. You can put an endoscope and see. The third thing, what you learned from this case, Salman Khan, is this, that stereotaxic. Stereotaxis, when it has come, it has changed our outlook completely. And he explained beautifully. See, the stereotaxic frame is a frame which you put around the head like a tie, and very painful, naturally, very painful. It localizes the trigeminal nucleus from outside accurately, so accurately that if you put a light which is equal to a knife, it can burn immediately. So that's another thing we have learned, and now we have got stereotaxics. And next thing is, sometimes this neuralgia is due to an aneurysm pressing on it or AV band formation. If it is aneurysm, we can do coiling. Coiling is about 2 lakhs rupees per coil. You go inside the brain, put the coil. Go inside the brain, put the coil. If it is AV band formation, like he has got, you could try to do what we call as embolization to cause necrosis. Anyhow, the point is that we have now lot of treatment, but do you know that I must have at least a dozen patients up to now who are still on carbamazepine. I told you, it's not an uncommon disease, and many patients will respond to medical treatment. What is the medical treatment? Treatment of epilepsy drugs. So gabapentin, propentin. Nowadays, as I said, you can coil, you can embolize, and you can actually do surgery of the ganglia and remove the vessel which is pressing. So that is the story of trigeminal neuralgia. Very treatable. This lady came for sudden seeing double, diplopia. Diplopia double is a very important complaint. The moment the patient says he is seeing double, he has got paralysis. Simple, paralysis of the eye muscles. This lady had, of course, fortunately, all these patients should be investigated to exclude space-occupying lesion, tumors, etc. Ultimately, you find nothing. She was a diabetic, she responded to diabetes treatment. This girl came to me for headache and vomiting of about 2 weeks duration. She had seen 2-3 doctors, but to me it was unusual. I said low fever, headache, so TB meningitis. Today TB meningitis has changed the course. Please remember that. All these mild fever, mild headache, they can be all TB meningitis. And TB meningitis patient, if you do CT scan, this scan, nothing you will find. Central CSF, most important CSF. Do a lumbar puncture, diagnose. Now, when I looked at her, I thought she had a slight squint. And I asked her, do you see double at times? She said, yes, I am seeing double at times. So, I told her to look this side, and you're going to see the squint. She had a squint. She recovered completely with anti-Cox treatment. This man's eye suddenly dropped and closed. On opening, you would see the eyeball rotated there. This diabetic patient one day came and said, eye is closed. When eye is closed, you will not get diplopia or see double, etc., etc. So, these patients, of course, should be investigated for any space occupying lesion, but most of them will recover continuation treatment of diabetes. And mostly this fellow has got the same thing, partial, third nerve we call it, third nerve palsy. Now, this is a patient, Amitabh Bachchan had this illness, was supposed to have this illness, went to America for that. 9 out of 10 doctors miss this disease. 9 out of 10. And my students always remember one thing. If any neurological complaint occurs at night, evening, in the morning is not normal, it is Myasthenia gravis. And fortunately, Myasthenia gravis in our country is ophthalmic type. Means mainly involves ophthalmic type of muscles. Therefore they go to ophthalmologists. And ophthalmologists miss it. But it's a beautiful disease in the sense that in the evening that eyelid falls. In the morning it opens. I mean, it's such a simple diagnosis. And not only that, you give prostigmine tablets, like magic they work. Give prostigmine tablet, he is alright. Yes, there are patients who are not responding to prostigmine, then steroid. Steroid is an excellent treatment of myasthenia gravis. And as a GP, why should you know about antibodies, thymus, Then Amitabh Bachchan said thymus operation should be done from here to here. And he said, I'm a hero. How can I have a big scar there? Now we don't believe in all these things. All these tests are misguiding. Yet this illness persists. Remember that. And finally is the last, most common cranial nerve palsy, which every GP will see in his practice every 2 to 3 months. And plus, look at the tragedy of the disease. It occurs at all ages, all sexes. So imagine a college girl one day goes to the college and they're talking and she starts laughing like that. Like that she laughs. So it's very obvious she's got paralysis. Very embarrassing. She will not go to the college for 2 months. So embarrassing. When Anupam Kher, actor who was such a famous actor, 30, 40 years back, one day he was laughing and he started laughing like that. Like that. So he could make out that there is something paralysis. He saw the topmost doctor, singer, but could not accept. He went into depression. He was thinking whether he should commit suicide. His profession is gone. The story is opposite. I want you to know, it's a beautiful disease to handle. If you get it, you are lucky. If you get it in your private practice. No, these people cannot do. When he looks up, you see this part does not contract, right side. This contracts. Unfortunately, most of the patients think of the paralysis on the normal side. Why? I'll tell you, you see, similarly, if eyes close tightly, see what happens. This eye cannot close tightly. Remains half open. Show the teeth. Yeah, that is the time when it comes out. Now, if you now see the face, a relation, a normal person, will see that this is not normal, beautiful. He looks so young. So they'll say that this is normal and this looks abnormal. Like that is making. So they will think this is paralyzed, this is normal. It is not, it's the opposite. He blows more because he has got no tone. That's why he can blow more on that side. This man came for same. Paralysis on this side. And I was told, no, paralysis on this side, not this side. Even this leg goes back down with this paralysis. And you can see this nasolabial fold becomes less. And even the angle of the mouth here, see, is low down. Saliva can come from there. Anyhow, but this disease, although we are so much advanced, we are talking about all those stereotaxic procedures, coil embolization, and in common illness like Bell's palsy, very little advances have been made. Very unfortunate. But what the GP should know, that these Bell's palsy patient paralysis, you leave them alone. They will all recover fairly well without any treatment. That's the beauty of the disease. then why are we trying to treat? That is because they will take 2-3 months to recover, and here, by giving our treatment, we can recover in 1 week. 1 week. And so I call this as medical emergency. Bell's palsy is a medical emergency. Treatment in the first 3 days is more important. You should start treating after 2-3 days, less important. And you give the treatment steroid, prednisolone, 60 to 80 milligram for 1 week, then taper off. Not small dose. Then you will say, no, my patient has got diabetes, blood sugar is 140. Don't worry about all that. Nothing will happen to the blood sugar if you use only for 1 week. 60 milligram for 1 week, taper off, and then is of course valacyclovir, antifungal drug that you can use, nothing wrong in that. And all you have to be smart to point out patients who will not recover from the first day only. Patients who have got complete 100% palsy. Absolutely. We can't do any movement at all. Severe pain. Old people. Don't give. I had this usual, I should try different treatment, and in my consulting room, at the end of 1 month, patient had plus recovery. At the end of 2nd month, nearly all right. Nearly all right. And at the 3rd month, 100% all right. And finally now, they only one problem left for GPs, which is a difficult problem. I agree. All these years, not all patients, some patients, 3-4% patients used to come, that after they recovered, they used to have aberrant renovation, unwanted facial movement. You know, somebody is talking and suddenly he does it like that. 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 Suddenly, not continuously. And they used to come, and we had nothing to offer. There was no treatment to offer. Fortunately now, for rich patients, we have got a treatment for botulinum toxin. This bot toxin, when given, at least for 6 months, it will prevent all the movements, and the patient should be happy. Thank you.